thing I want to talk about is probably the most important. And I'm going to share a story with you about one of my mentees. Now, my mentees, they had an interview, interestingly, and in the interview, they were asked, if you're attending or if you're senior, saw a patient and wanted to have them undergo a test or an investigation, and you are in a position and you know that this is inappropriate testing, this is actually doesn't follow the guidelines. You are the intern, they are the attending. What will you do? Now, that question in itself is not really asking the question. What the question is asking is very simple. They are asking, are you able to pause and withhold your perceived knowledge and ask the other person for their thought process? That's what they're saying. So do not ever reply and say, I would say, no, this is not the right thing to do. This patient doesn't need this test. This patient, I will not put this test in. Please don't want to do this test. No. What you are supposed to do is take a pause and say, reply, I would have thought that maybe this patient doesn't need this test, but help me to understand what your thought process is about, ordering this test. What you are trying to tell me now is that you are able to put your own knowledge on hold and seek for my thought process before jumping the gun.